Good afternoon. Welcome to the EMA office where we bring you the latest in the COVID numbers. Here with the chairman, Mark Kern. Today, Brian Whitaker. Brian, you have the numbers, and it's a beautiful day outside.
Yes, sir. So in St. Clair County, they've tested 321,222. That's an increase of 1,065 since yesterday. Positive test results are 29,701. That's an increase of 54 since yesterday. Those are males and females under the age of 1 up to their 60s. That brings our daily county positivity rate to 4.8%. Negative test results are 291,521. There are no new deaths to report today, so our countywide death total related to COVID-19 remains at 473. For the IDPH required 10-day isolation period, there have been 28,871 that have completed that period. For state totals, they've tested 21,017,929, with positive test results of 1,273,200. That is an increase of 4,004 since yesterday. Sadly, the state also announced 21 new COVID-19 related deaths, bringing the statewide death total for COVID-19 to 21,476. For hospitalization numbers, those hospitalized in St. Clair County, we have 19 patients admitted due to COVID-related illness and 0 patients on ventilators. Regionally, we have 42 patients admitted due to COVID-related illness and also 0 patients on ventilators. For our congregate living facilities, we'll only announce the changes. Today, the changes at Mercy Rehab and Care Center in Swansea. They have 133 cases and 18 deaths, and that is an increase of 1 case. As we like to remind you every day, testing is still available and still very necessary. It's available Monday, Wednesday, Friday, and Saturday at the St. Clair Square test site from 8 to 4, and also at various pharmacies and express medical facilities throughout the county. I'll turn it over to Chairman Kern for his update.
It sure is smooth at the fairgrounds. I mean, it is
It's
a half-an-hour process. The National Guard's doing a great job. Logistically, you really put together a real great program there.
Thank you. Yeah, they make little tweaks every once in a while when you see things that can work better, but it's definitely to the point now that, including that observation period, most people are in and out within 30 minutes.
And that really is a credit to Mr. Simmons and to the health department and to the National Guard, to the state, IHP, the Illinois IDPH.
Yes, sir.
I say IHPA, which isn't what it is. So IDPH is the Department of Public Health. I mean, they've all been a part of this, and it's really an awesome thing. So you really need to get down there and get vaccinated. It's really the last step to getting back to normal. Lots of people have had their second doses with no bad consequences, and now they're able to go out and feel comfortable that they're not going to catch COVID. So continue to wear your mask, wash your hands, watch the social distance, but let's make sure we get those needles and arms. So tell all your friends, if you have relatives that are on the fence, ask them to do research, to take a look, talk to people who've had the vaccination, and they'll find out that it's a great process and well worthwhile. So let's take a look at the zip code reports, because we still do have COVID positives coming up in St. Clair County. 62201, we went up 4 today to 595. 62204 went down 1 to 405. 62205 up 1 to 648. 62206 up 2 to 1,330. 62207 up 2 to 599. 62208 up 4 to 1,677. 62220 up 8 to 2,126. 62221 up 12 to 2,842. 62223 up 4 to 1,791. 62225 down 1 to 143. 62226 up 4 to 3,258. 62232 up 1 to 919. 62243 down 1 to 789. 62254 up 2 to 810. 62264, down 1 to 372. 62260, up 1 to 823. And 62269, up 9 to 3,340. 54 new positives, 1,065 people tested, brings that daily county positivity up today to 4.8%, but the rolling average does go down to 5.1%. The regional positivity remains static at 3.4% today, and that's because our friends in Bond County call in at 0.7%, Clinton County 3.1%, Madison County 4.2%, Monroe County 4.7%, Randolph 0.7% today, St. Clair is at a nice 1.5%, and Washington County at 2.4%. So Herb, nobody on a ventilator, 19
great
in the
news.
hospital. We'd like it to be zero for the hospitalizations, but the numbers really appear to be headed in the right direction. We just have to get over the hump. Let's get through April. Let's get into May, get needles in arms, and we can all enjoy our summers like we did 2 years ago.
Well, I think that's just an indication of what is working. Zero on ventilators, the hospitalization down to 19. I think that shows the work that the medical staffs are doing at the hospitals and treating the cases that are still there. One of the alarming rates is, and we talk about it every day, out of the 54 positives, 44 of them under the age of 40. I think that's that population, and you see on the graph that you had there that those are the age limits that's got to start taking this a little bit more serious and getting those shots in the arms.
Governor Pritzker has gotten us the vaccine. I mean, we have Pfizer available in good quantities, so there is no excuse not to get vaccinated. And you're right, Herb. It's not a secret why these numbers are down, why hospitalizations are down. It's because of the vaccine, and the vaccine has worked in populations. We had 0 people in their hundreds, 90s, 80s, and 70s today, and only 1 person in their 60s that got that contracted COVID. So it shows, because I assume we've been open for a long time for that age group, that a lot of people partook in the vaccine. I think it was over, what percentage, Brian, do we know?
I will look and let you know here just a second.
Put
Yeah.
Brian on the spot, but I mean, there's a very high percentage of people in St. Clair County, 65 and above, that did go and get that vaccine. They've now had both doses, and so they really have their maximum immunity, and it really shows.
Well, and when you look at the congregate living centers, those numbers when we first started 300 and some days ago, they were up, and now they've all been vaccinated apparently, because those numbers have decreased. So we just got to get the word out to this younger 40 years of age. Brian, did you find out?
I did. 73.43% of our population over 65 has been vaccinated,
Good percentage.
compared to 30.2% of those under 65.
So there you go.
So-
It's proven we can get these numbers down to 0. We just have to get people vaccinated. So everything is available. It's a fairly painless process.
How would you know that?
Certainly, logistically, it's painless, and the needle is not anything to be scared of.
No.
So it all worked really well.
I think it's important to mention for those that have been waiting for that 1-dose Johnson & Johnson, that's tomorrow. Fairgrounds is doing a full day of Johnson & Johnson vaccines tomorrow, so it's 1 dose, 1 and done, and there are definitely still appointments available and also drive-up available.
Right, and they can go this afternoon if they want to at 5 o'clock.
Yeah.
So they don't need an appointment.
18 and above,
For the Johnson & Johnson, it is 18 and above.
and live or work or go to school in Illinois. So those 3 things, a lot of people qualify, and it's a 1 and done shot.
Right, and like we said, the numbers aren't lying. I mean, it works, and we can continue to make it work. Great news, like we said, nobody on the ventilators, and we want to get them down, the hospitalization numbers even lower. Thank you to our hospital partners, HSHS, BJC, Touche Regional, the health departments. Everybody's doing a fantastic job. Eastside Health District, Liz Patton, Whiteside, Mila and her whole crew, the National Guard. Our first responders are still out there responding to any of those calls that we get. So It's Team St. Clair, and I couldn't be any prouder, and I know you are too, Chairman. 392 days we've been here, and like I said, we're going to be here until the light at the end of the tunnel is the only thing we can see, that the virus has been locked away. We're going to be back with Cindy in a few moments to translate this into our Spanish communities, and then we'll be back tomorrow for day 393. Everybody have a good evening.
I have battled this virus both professionally and personally. Professionally, I can tell you firsthand that it's greatly impacted our community, caused the loss of many lives, and continues to spread today. Personally, I can tell you that I contracted COVID-19, and it definitely is not the flu. This virus affects everyone differently, however, many have severe consequences. Please take this time to help your friends, your family, your neighbors, and the entire region by wearing a mask, washing your hands, and watching your distance. Together, we will overcome this invisible enemy.